Hi, I'm Dr. Ravi Senanan, and today we're talking to an eye specialist and we're going to speak a bit about diabetic eye disease.
So, most of our patients who present to us in the clinic are diabetic. 80% of diabetics will have diabetic eye disease after 20 years, especially if the sugars are uncontrolled. In the acute phase, if the sugars are very high, in the short term, the vision can fluctuate and the patient will complain of a sudden decrease in vision, which usually resolves quickly. On the other hand, in the long term, diabetes affects the film at the back of the eye, which is in this area here where we see numerous blood vessels. In this type of diabetic disease, eye disease, it is much more concerning because it is much more long-lasting, as well as it can lead to a patient becoming permanently or irreversibly blind. This type of disease is called diabetic retinopathy. Essentially what occurs is the blood vessels in the retina, which is responsible for the vision, becomes leaky, it becomes damaged. And also they bleed. What happens at this point is when the blood vessels leak, the center of the vision, which is called the fovea or the macula, is compromised and the vision decreases gradually, in some people maybe even suddenly. They come into the office complaining of poor vision, and when we check these patients, we notice a lot of swelling or edema in the macular area, as well as throughout the retina we notice bleeding. Sometimes the bleeding can be so severe where abnormal blood vessels are seen lining the retina because of the poor blood supply or the compromised blood supply, and the eye responds by producing new abnormal vessels which subsequently bleed. These blood vessels are very friable, they break easily, and the jelly inside of this area here called the vitreous humor becomes filled with blood. These patients complain of a sudden loss of vision. They go to sleep at night and they get up in the morning and they are completely blind. They just see shadows or just light. At this point, we perform a dilated examination, and it may be difficult at some point in times to see the retina, and therefore an ultrasound is required to determine if the retina has been compromised. Other than this, provided that we can see and assume that the retinopathy requires intervention, we will provide the patient with options. These options may include injections into the eye for the bleeding and the swelling, or they may require laser surgery, or if the retina has been detached, they will require referral to a retinal specialist.